I think one of the most valuable lessons we learned over the years, with going more and more extreme and more wide-reaching with body contouring surgeries, is the somewhat delicate relation between skin and fat. And if you want to do credit to what we do, skin protection is probably one of the most valuable lessons we've really learned over the last years, because there is a couple of limits to liposuction, and I think the most three important ones are, first is a medical one, anemia hypovolemic shock. So if you've got a patient with a lot of subcutaneous fat attack, if you go over a certain percentage of body weight, the patient will go into anemia, will require blood transfusion, and can get health problems. So this is the first limit. You have to stay. You want to go to the absolute maximum you can remove possible, but you don't want to put your patient in danger. That's point number one. Point number two is more an aesthetic one. Skin can go very loose, after liposuction. That depends a little bit on where you do it. There's typically areas that respond very well to lipo. Skin retraction is extremely good, but then there's areas where it's not so good, so you have to be a bit more careful. The center of what I want to talk about today is skin damage, skin burn, skin pigmentation, which is not only a problem of lipo, but mostly a problem of compression. Quickly, I think this is a very valuable slide, to share with patients, and I share that at meetings too. And you see in different colors how skin responds differently to different areas of lipo. So for the probably most diametrical examples is the lower back, which you see here in green, and in the purple color, the inner thigh. The lower back skin retraction is literally unlimited. You can remove a lot of subcutaneous fat. In the inner thigh, you have to be extremely careful, because even a little bit of lipo can create loose skin, and no thing like J plasma or body type will completely prevent that. So you will still have to hold your horses with that. You do not want to end up in a situation like this, because this is liposuction is possibly too aggressive or too much compression. Or the use of energy-based devices causing too much fibrosis. It's also bad lighting of the photo. To understand the limits of liposuction, I think this little video here is very helpful. You can see here that between the pelvic crest and the 12th rib, you pinch. You can go down to a pinch of about 1 centimeter. If you go beyond that thickness, the skin vascularity comes into danger. The skin will usually tolerate that. So I think if you want to get the kind of results, that we really want to achieve, you have to be that straightforward with the lipo. But at the same time, it's very, very important to try to control the factor that you can't control in surgery, which is the compression element, because skin damage, to my humble opinion, is usually a product of the sum of compression plus surgery. So the compression has a crucial role. And if you want to understand, how these tissue damage can occur, I think it's always very helpful, to check kind of layer structure of the skin. And you see here in the dermis, if you go too close to that and you end up with too aggressive a lipo devascularizing the skin, then you can get a skin necrosis. And the usual chain of event is you go very, very thin, you have enough vascularity, but then there might be too much compression, stressing and strangulating the skin, and that then results in skin damage. You see here, this is, for example, on the left side, you see here day 1, day 2, day 3. Vascularization damage. There's a couple of treatments that we find very, very effective, going from hyperbaric chamber to needling and different things. But I think the most important part is compression relief, at least for a time, to give the skin time to recover. Most of these things with good and forthcoming treatment do recover. Why is that important? Because on one hand, specifically blessed, with very motivated patients who all want to go the extra mile, for completely breathtaking results. But we have to understand, too much of anything is not good, and they tend to compress. So I think the first point is probably the most important one in protecting your patients against skin damage, and that is simply take the garment off 1 hour a day minimum. That is because we really have patients who left the garments on for 5 days or 6 days just because somebody on the internet has told them that that can be detrimental. We use hyperbaric pressure treatment. This is a bit controversial. The scientific evidence is a little bit thin, but I think it's very helpful, especially for de-swelling the patient. Nitro patches with 12.5 microgram on each side. Handled with care can cause a bit of headache because they increase intracranial pressure, but are helpful to improve skin vascularity. There's a couple of very effective micro-injection treatments, mainly with vasodilators, which we also have made very good experience with, carboxytherapy, and these things, can really do the difference in these cases. Now, the take-home message is a good liposuction is a bit, and I think that's a fantastic metaphor, is a little bit like salt in your food. It's not the more the better, but it's the right amount that counts. Too much compression is actually worse than too little. That is something that currently we at least, if it was for us, we need to bring across a little bit in our patient community. Because that is a bit dangerous. People think that just the more they compress, the better the result will be. You can end up with some serious skin damage. So please bear that in mind. And with all these other treatments, which we love and which we've made great experience with, is cyclic relief of pressure is essential for skin protection. So I think this is hopefully helpful, for our patients, to understand a little bit the dynamics of this, and for surgeons who want to kind of fuel their practice a little bit in that and push the lipo limits further, and at the same time be on top notch, about how to protect patients from collateral damage. I'll point out, our next live surgery course on the 18th of September, where we make a full session just about perioperative care, which I think is a very fascinating topic. So I hope to see many colleagues there.